Morning, everyone. Welcome. And my name is Elisabetta Trinari. I'm a developmental pediatrician working at McMaster University. Hi, everyone. And just a couple of um, things at the beginning. I have no conflict of interest to disclose. This is a nice picture of the McMaster campus. And this is the McMaster Children's Hospital, where I work with my colleagues in the tuberous sclerosis clinic with Dr. Robin Whitney, who is a pediatric neurologist who founded the clinic a few years ago, and our nurse practitioner, that is the clinic coordinator, and we are connected with various subspecialists, geneticists, oncologists, cardiologists, and we are seeing patients from 0 to 18-year-old. And today I would like to talk a little bit about TSC and in particular to focus about TAND. What is TAND? What are the implications of TAND for tuberous sclerosis? What are the levels, the cluster, and the future direction for TAND? And now, very briefly, I guess most of you know that TSC stands for tuberous sclerosis complex. And tuberous sclerosis complex is a complex multisystemic genetic disorder. It's rare, but not so rare because we are expecting that about 1 to 2 million people worldwide may be affected. And unfortunately, in many cases remain undiagnosed. TSC is caused by a mutation, a variance in one of those two genes, the TSC1 or the TSC2 gene. And about 70% of the patients have a mutation in the TSC2, about 20% have a mutation in the TSC1, and about 10% have no mutation identified, but they have the same manifestation of the tuberous sclerosis complex. So the severity, there's a great variability in disease severity, the number of symptoms and the severity of symptoms, and the prognosis is often associated to the severity of the symptoms. And very briefly, just to mention the mechanism, pathogenic mechanism behind tuberous sclerosis, the two genes that I mentioned before, they are responsible for the production of proteins. And when they are, there are variants, there are mutation in those genes, the proteins, the hamartin and tuberin, have some defect. And so these two proteins, they form a complex, an intracellular complex that regulate the mTOR signaling. And the reason why it's so important is that the mTOR signaling is regulating the growth and the cell division and the growth of the body. And so an overactivated signaling will lead to improper regulation of cell growth and tumorigenesis. And as you may know, tuberous sclerosis is associated with a wide range of physical manifestation. We have manifestation in the brain, in the heart, in the kidney, in the lung, in the skin. And those manifestations are not only very variable in severity and in number, but also they may vary over time. So that some manifestations as the cardiac rhabdomyomas are more frequently found in children very early or even prenatally, while other manifestations like the pulmonary involvement are more common in adolescents and adults. But today I would like to focus more on TAND. What does it mean? What TAND stands for? So TAND stands for TSC, tuberous sclerosis complex, associated neuropsychiatric disorder. And this was a term that was coined back in 2012 by the International Consensus Guideline Group. Before that, it was well known that tuberous sclerosis was associated with neuropsychiatric manifestation. But those were not really addressed as needed. In fact, there was a study in 2010 from UK reporting that only 18% of families had ever received any recommendation or evaluation or treatment for this range of neuropsychiatric manifestation. And TAND has been identified by families as the greatest clinical burden of the disorder. And unfortunately, still today, is not always treated and identified and treated as it should. We know that TAND affect the great majority of the individuals with TSC, such as the risk for TAND is up to 90%. So up to 90% of the individuals with TSC may have some or more aspect of TAND. And this is a nice picture about TAND to describe the different levels of TAND, 6 levels. It's kind of an umbrella term that include behavioral, psychiatric, intellectual, academic, neuropsychological, and psychosocial aspects. The reason to come up with that term, with a specific term, was a strategy to also increase awareness and action around TAND and to generate a shared language so that communication across researcher and strategies to address those problems were more outlined and identified, and action could be taken. One thing that I need to highlight is that individuals with TSC have unique and highly variable profiles. So not everyone will have all those manifestations, but may have a different profile, a different mix of those manifestations. And after creating the term, the TAND term, the next step was to create a way to identify those difficulties and to guide healthcare practitioner in the screening process for TAND. And so in 2015, the TAND checklist was created. This is available. You can find it easily online, and we will go through the different part of the TAND checklist, and we'll take a little bit of time to review the different levels. But essentially, the TAND checklist was created to allow a regular screening, a screening that should be repeated at least annually, to identify any emerging symptom of TAND. So the TAND checklist starts with a general first section that is about development and developmental milestone. So as you can see here, it will ask question about the age when the child first started to walk independently or first started to use words for communicative purposes. And then there's a second section that is about the current level of functioning in terms of language, self-care, and mobility. And then from the third section going on, the checklist look at the specific TAND levels. As you remember from the picture, the umbrella picture, the first level was the behavioral level. And in the behavioral level, we look at behaviors like aggression, self-injuries, inattention, impulsivity, various behaviors. These are all the things that could be observed by the clinician, but most of the time are observed by the family or the teachers. And very often, those are the behaviors that lead to the referral, because those are behaviors that impact the functioning of the kid or the adult with TSC. And I need to specify that those are not diagnoses, are just behaviors that are observed, because some of these behavior may be more or less appropriate depending on the developmental level of the kid. For example, if we think at temper tantrums in a 2-year-old, that will be different than a temper tantrum in a 10-year-old. And so the next, before we go to the next level, as you can see, the frequency of those concerned and behavioral concerns is very, very high. You can see the number. These are extremely high for many, many of those. And then the second TAND level is the psychiatric level. This level is defined by psychiatric diagnosis, and we usually make diagnosis based on the classification systems, like the DSM-5 or the ICD-11. So the diagnosis could be things like autism spectrum disorder or ADHD or depressive disorder or anxiety and so on. And we know that the frequency of this disorder in the TSC population is unfortunately quite high. We have up to 50% of the individual with TSC with autism, a very high frequency also of ADHD or anxiety and depressive disorders. The third level is extremely important, is the intellectual level. When we talk about intellectual level, we are referring to cognitive abilities that are measured with standardized tools, with standardized scales. And the intellectual level refers to ability like reasoning, planning, problem solving, abstract thinking, comprehension of complex ideas, or learning. And we know that about 50% of the individuals with TSC may have some level of deficit in their cognitive skills. And the cognitive skills are usually categorized in different levels, as you see here. But another aspect that is very important in tuberous sclerosis is the fact that even in individuals with normal cognitive skills, sometimes we find uneven profiles. So not all of the cognitive skills are at the same level. We see some areas of strength and some areas of weaknesses.
Everyone involved 都会有 intellectual disability.
Yes, sorry. Can you say it again? Okay, I couldn't understand, but I'll continue. Please feel free to write in the chat if I need to stop. So the next level is the academic level. And the academic level is referring to specific learning disorders as defined by the DSM-5. So difficulties in reading, writing, spelling, and mathematics. And again, even among those individuals with TSC that do not have any cognitive delay, the learning disorders are quite frequent. So it's something that we need to consider. And then the next one is the neuropsychological level. We are talking about things like sustained attention, dual tasking, the capacity of the immediate recall memory or the spatial working memory, all those cognitive skills that are often not evaluated, especially in those individuals without cognitive deficit, but are very, very important because they affect everyday life and school. And so the next level is the psychosocial level. And this level explores the psychological and social impact of TSC on the individual, but also on their family and on their community relationship. Things like self-esteem, self-efficacy, parental stress, those are extremely important when we think at TSC and the impact, and in particular, when we think at TAND and the impact that has on the life of the individuals and their families. So the TAND checklist, after looking at the different levels, has a specific section asking about rating the level of difficulty. So the question is, based on the concern that you have reported, how much those concerns are bothering you or are distressing you. And among all the concerns that you have reported, which are the priority that you have for treatment? And if, of course, if we have missed something, we ask to know if there's something more. So after creating this term, the research around TAND has increased over time. But as you can see from this map, the majority of the sites, the research sites, are located in high-income country. And unfortunately, many low-income country and middle-income country are not yet participating much in TAND research. This is a very important study. The TOSCA study is a registry, an international registry across 31 countries, including more than 2,000 participants. And the conclusion or the information that we got from studying those data are extremely relevant. One first important information was that the intellectual abilities are a risk marker for most TAND manifestation. So the lowest the cognitive skills, the higher the risk for autism, ADHD, and other comorbidity. And when we take into consideration the intellectual ability and we stratify for different levels, so what I mean, we are comparing kids or individuals with TSC with the same level of intellectual ability, we can see that ASD and ADHD are more common in males. We can see that ADHD is more common in children, and depressive anxiety symptoms disorders are more common in adults. And finally, that the TSC2 variant is more commonly associated with intellectual disability. And so we have a more severe phenotype, but it's not the genotype itself that is linked to autism or other manifestation. So, as I said before, individuals with TSC have a unique and highly variable TAND profile. And this complexity can lead to difficulty when it comes to intervention because it's hard to decide and to treat in the correct way because of the complexity, the multi-phase presentation. So to try to reduce this complexity and to provide guideline, a researcher from the TOSCA study that I showed you before tried to see if we can group those symptoms, if we can group all those items that we have seen in the checklist into cluster. Because when we look at levels, we look at everything and we are trying to be sure that we assess and are not missing any of the level of the TAND. But then when we think about how to implement strategies, recommendation, and treatment, looking at cluster could be very beneficial and helpful. So cluster are overlap, cluster are co-occurrence of items beyond levels. And in fact, they were able to find different cluster, in particular 7 cluster, plus one wraparound cluster, one psychosocial cluster. And you can see here all the cluster in different colors. And what I would like to do in the next few minutes is to go over each of those clusters and review with you the recommendation that were made by the consortium, by this expert panel.
Elisabetta, there are a couple
Yeah.
of comments in the chat. Do you want to
Okay.
go through them? Okay, I'm going to go. The first
Yes.
one, is it okay? The first one is from Raymond, and it says, our son is an adult with aggressive tendencies. He is titrating off lithium for behavior due to kidney problems, but what other med would be a replacement? We've tried antipsychotics with no success. I want to say, though, that we can't recommend treatment for your specific case in this. This is sort of a general lecture, but I don't know, Elisabetta, do you have any comments that you want to make?
No, it's very hard when we discuss about medication, and probably the next part of my presentation will explain why it's hard to give general recommendation, because when we think about intervention and medication, we should be very, very careful in addressing all the different aspects. It's not just trying to solve, and of course, that's a very important and severe behavior. So we want to do the best we can to treat it. But to treat it well, we need to consider everything else. And it's hard to give recommendation so specific for a specific individual without knowing him, without not knowing all the history and the previous treatment and so on. So yes, I agree with you, Maria. It's very difficult to give specific recommendation, but I hope that the next part of the presentation will give a sense of why it's hard, unless we take into consideration every aspect of TAND.
Okay. And the second question was from Catalina, who asked, is it more common in males for the same reason as people without TSC, because females tend to mask?
It's yes and no, in the sense it seems that there's the same. So if I go back to my previous slide, here ASD and ADHD were found to be more common in male when accounting for intellectual ability. So when comparing groups with the same intellectual ability, and yes, it's more. We know that autism is more common in male in general, without thinking at TSC in particular. The reason, though, it's under, there's a debate about the reason. We don't really know clearly why the reason, but it seems that probably outside from the masking, so from the behavioral thing that we can see, there's a genetic reason very likely. So there are some protective factors in females that we have not well understood. But we know, for example, that when we have a female affected, and I'm not talking about TSC, when we have a female affected by autism, the siblings tend to be affected more with a higher frequency. There are some differences, and I don't want to go into the detail, but this is a very good question, and that's a question that needs more research still. Okay. Maria, yes, I will continue, and maybe we can go back on other question later, if it's okay.
Yes, we'll do that. And then I do have to leave at 1:45, so I'm going to ask Yanning if she could look into the chat and read off any further questions after you've completed the presentation.
Absolutely. Okay. So talking about the cluster, so as I said, the first cluster were described in 2018, and then looking at the data from the TOSCA study, it was possible to run additional type of analysis, cluster and factor analysis, and confirming this 7 cluster plus the wraparound psychosocial cluster. And now looking at each one of those, the first cluster is the autism-like cluster, and we are talking about behavior like or symptoms like absent or delayed onset of language to communicate, the echolalia, so the repeating of words and phrases over and over again, the poor eye contact, the difficulties in getting on with people of similar age, those behaviors that are repeated over and over again, or rigidity and inflexibility or difficulties with routine, with the changes in routine, difficulties with transition. So for this specific autism-like cluster, the consensus group made specific recommendation. And the first is that every individual with TSC should be monitored for autism-like cluster. In fact, if we look at the frequency of these autism-like behaviors, those are very, very, very frequent. The rates are going from 40 to 69%. And then the monitoring should start early and should continue through adulthood. Every kid that has autism-like symptoms should be referred for a formal assessment. And in fact, we know that, as I showed you before, we know that the frequency of autism in TSC is up to 50%. When we look at what we need to do in kids with TSC that have either autism or autism-like behaviors, we know that we have some intervention and guideline developed for the general population. So we don't have guidelines specific for the TSC population, but the autism in TSC and autism in people without TSC look very similar. So we know that we can apply those indirect evidence to our population. And there's evidence for naturalistic type of behaviors, naturalistic type of behavioral intervention to improve social communication and behavioral outcome in young, especially in children with TSC. And there is evidence for social skills intervention in adults and also in children that have a good level of language. And one last recommendation was that it's important to monitor the comorbidities that we would monitor in general in autism, but even more here. We need to monitor for co-occurring psychiatric conditions, co-occurring developmental condition, or physical health disorders. The next cluster is the aggressive, dysregulated behavior cluster. And we are referring to symptoms like aggressive behavior, temper tantrums, self-injuries like hitting, biting, scratching. And the recommendation that were made for this specific cluster are that the type of approach, the type of assessment of dysregulated behaviors should be systematic. We know that dysregulated behaviors are very common in TSC and have a major impact on the family. It's extremely important to understand the meaning and the function of dysregulated behavior to guide intervention. In fact, sometimes some of this behavior could be driven by inability to communicate. Other time, this behavior could be driven by a scope of reducing anxiety. So some of this behavior could be self-soothing for some individuals. Other time, hyperactivity and impulsivity could driven dysregulated behavior. Other time are sensory-driven behavior or attention-seeking behavior. And very commonly, there are some escaping demand. So to avoid demand or request. Or also, we should not forget some pain and discomfort could trigger dysregulated behavior. So whenever we assess dysregulated behavior, it's extremely important to look at the antecedent and the consequences of the behavior to kind of try to understand the meaning, the function of it. The other important aspect is assess and understand the intellectual level and the neuropsychological profile of the individual with TSC that is manifesting some dysregulated